All right, let's talk about how you can make a real difference with patient nutrition and hydration.
I mean, the challenge is massive. In the UK, we're talking about 3 million people at risk.
And the financial hit? It's staggering. It costs about £22 billion just to treat this. So, first things first, and this is key, we need to spot who's actually at risk.
Regular screening and weekly weigh-ins, they're your go-to tools for tracking how a patient's doing. And this definition, it's super important. Any unintentional weight loss is a massive red flag for us.
Getting this right is crucial. Always use the correct equipment for safe, accurate weighing. Okay, so let's get practical. What are the first-line things you can do every single day? For patients with poor appetites, this is a game changer. Big meals can be just too much. And you can really see the difference here, right? That little and often approach works wonders.
So before we jump to supplements, try this food first method. It adds calories, not volume.
And of course, we can't forget about hydration. It's so important for the body. Keep an eye out for these signs. They're easy to miss, but tell you a patient needs fluids. Simple things, right? But they stop dehydration, which can really derail their therapy progress. So what happens when food isn't enough? That's where oral nutritional supplements, or ONS, come in. These are prescribed when that food-first approach just isn't cutting it for the patient. And look at all the options. Having this variety is great for preventing flavor fatigue. How you help administer and track these is key to making sure the patient actually benefits. Okay, let's bring it all home. Why is your role in all this so incredibly important? Your observations are a huge part of their recovery. They need to be strong enough for rehab. You're on the ground, spotting warning signs and encouraging them every single step of the way. See? Small, consistent actions really add up to a massive impact. So, what's your next step?